for sleep disorders. The purpose of this video is to go over what the Stop Bang screener is, get you familiar with a home sleep study device you may see on your inpatients, how to properly measure a neck, and how to remove the home sleep study device in case of an emergency.
During the Stop Bang process, there's an 8-question process. One of the processes is we get a neck diameter measurement, and for that we will use one of our disposable tapes, and we're looking for a neck circumference greater than 17 inches. So for example, for a male patient, we'll be sure to go over the Adam's apple so we get the largest circumference. For this example, we're at 14 inches. On a female, because we will just try to make sure we get into the middle of the neck area to get that circumference.
Now I'm going to show you what a home sleep study device looks like when it's on a patient, so you'll be able to recognize it. I'm going to start by placing one on myself. Nursing won't actually place these on patients, but you may be asked to take one off in certain situations that we'll describe later. This is the main brain of the unit. It does all the data recording and it attaches to the shirt. Then I'm going to place 2 respiratory belts on myself. These are to monitor my effort to breathe during the night while I sleep. This is a wireless Bluetooth pulse ox. And last, a pressure transducer that goes at the nose to show flow coming in and out of it. In under 2 minutes, I'm ready for my sleep study. There may be situations where you will need to remove the home sleep study device from the patient, such as a diagnostic procedure like an MRI, a surgical procedure, deteriorating patient's condition, emergency intervention like coding, or by the request of the patient. If that instance arrives, I'm going to show you how to take this device off quickly and efficiently. First, you see these 2 clips. All you need to do is just unhook them. Then these belts snap off. You just place your finger in between them. Next, you'll just take off the cannula. The Bluetooth is wireless, so at this point, take the whole device here, what you have, and you'll place it in a treatment bag located next to the room. And then the same thing with this wireless pulse ox. It comes off just like a wristwatch, and it will go in the bag as well and be collected by the sleep lab.
Hi, this is Kristen Smith from Organizational Development. This module is going to show you how to document for the sleep apnea risk assessment. The first thing we're going to do is we're going to be logged onto patient record and we are going to find our patient. We are then going to select the charting icon to open up to their assessment page. So we're now under the charting and we want to go over here to the left hand side and make sure that we are under assessments. Now, depending on facility, the sleep apnea risk assessment will be a not a shift bundle, but an admission bundle, and will be populated for here for you to do. However, if for some reason it is not, and you need to do the assessment, we are going to go over here to the right-hand side of the screen where it says Begin New Assessment, and under the filter list, and we're going to scroll down until we find the sleep apnea risk assessment. This assessment will ask the patient 8 questions that we had previously learned in the beginning video. So it's going to ask them for their sleep and rest, what is their problems. This is a multi-select, so you can select as many that applies to the patient. So maybe they quit breathing during the middle of the night, or they have to sit up to sleep and maybe they snore. Now here comes the 8 questions of the stop bang assessment. The first one is snoring. So do they snore loudly, louder than talking or normal enough to be heard through closed doors? This is a yes or no question. The next one's about being tired. So do they often feel tired or fatigued during the day? Again, this is a yes or no question. Observed. Has anyone observed you stop breathing during your sleep? This is yes or no. The next one's about their blood pressure. Do you have or are you being treated for high blood pressure? Yes or no. The next is on their body mass index. Is their BMI greater than 35 kilograms? Yes or no. The next one is age. Are they over the age of 50? Yes or no. Next is the neck circumference. Now we do need to measure their neck circumference, which was previously demonstrated in the previous video. Is their neck circumference greater than 17 inches? Yes or no. And then the next one, are they of male gender? Yes or no. Now, this down here will give us a score. So our sleep apnea assessment total score is 8. Which indicates that we are at high risk for sleep apnea. Now, this right here is giving us this message that says to place a sleep apnea screening label in the physician progress notes. You guys do need to place a OSA screening sticker saying that the patient is positive for OSA on the patient's chart. Okay. Now, if you come down to the very bottom, if they've had a previous study before, you can actually mark this from here. Now, the last thing is to make sure you have the collected date and time, which is correct. Your status is always here as completed, so then we're going to sign and save. And that completes your sleep apnea risk assessment. If you have any questions, please contact us here in OD or contact the Sleep Study. Thank you.